Well, we're excited. We have a very special guest on the call. There's nobody that knows more about this industry as far as health and wellness than Dr. Walker. So I'm really excited that he's on our call tonight. And have a few questions, Dr. Walker, for you. Can you hear me okay?
Yeah.
You used to do, or maybe you still do a talk show.
In the next few weeks to a month, I'll be on Dr. Oz and a few other things that's going on. And as you may or may not know, my book came out about 6 weeks ago.
So from you coming from the medical standpoint and all the knowledge that you have and all the research that you've done on health and nutrition, you're just not a medical doctor. You know this stuff inside out and upside down. And when we launched Zeal, and I know you were represented with it, what do you like about our Zeal product, and how do you think that helps, especially I know you're doing the age management stuff. How do you think that really helps with all that?
Well, I mean, the thing I was intrigued about Zeal, first of all, I think you guys did a little commercial or marketing or a production showing all the stuff that's in Zeal, and I mean, it's loaded. It's just loaded. If you try to equate Zeal with all the different products, I mean, I think when you guys did this, you probably hit something like 40 products at a cost of what, $600 or something?
Correct. Yep.
And so, first of all, I was impressed with that. Second of all, some of the things that's in Zeal, most of the products never mention or people don't even know about. I'll give you an example. One of the constituents of Zeal is SOD, superoxide dismutase. Most people have no clue what that is or what it's all about. And again, it's called SOD. What SOD is we'll take our car in and we'll change the oil, but most people don't ever think about changing the oil, metaphorically, changing the oil in your cell. Now, what the SOD does is that's exactly what the SOD does. It basically is changing the oil in the cell. So what do I mean by that? I mean that what the superoxide dismutase does, it's an enzyme that has an effect on capturing the most potent and most dangerous free radical in the body, and that's called the superoxide free radical. Now, I'm not going to get technical, but this should be fairly easy to follow.
Okay.
When oxygen travels in nature, it travels as O2. There are two molecules of oxygen stuck together, and that's how they travel. They balance it out, and it stabilizes the oxygen molecule. In the body, as part of the process of the cell as an engine working, it produces, a car produces an exhaust, which is carbon monoxide. The exhaust for one of the exhaust products for the cell is the superoxide molecule, which is a molecule of oxygen which is by itself. That is a very unstable atom, and that atom is a free radical, and a free radical is a molecule or an atom that is missing an electron or missing its partner or something to attach to. What a free radical will do is a free radical is like a bowling ball in a glass shop. When you let that bowling ball go, it's just going to bounce around and it's going to break things. Well, the superoxide free radical damages the DNA of the cell, causing damage that can ultimately lead to aging, lead to cancer, and lead to disease. The SOD, which is in Zeal, captures that free radical. And not only does the product have the superoxide, but it's got all these other antioxidants. Now, remember that word. We hear it a lot, but an antioxidant. anti-oxidation or antioxidant, and it's loaded with antioxidants to capture all the other kinds of free radicals in the body. I want to mention one other thing about free radicals. In the DNA, you have what's called the DNA strand. It's a strand of the nucleic acid material. At the end of the strand, now as I'm talking, picture your shoestring. At the end of the shoestring, the DNA is the shoestring, but at the end of the shoestring, you have a piece of plastic. That piece of plastic is the equivalent to what we call a telomere. A telomere is a protein at the end of the DNA that keeps the DNA from unraveling. When you have all these free radicals rolling around in the cell in the DNA, what they do is they shorten the telomere. Now, studies have demonstrated that the shorter the telomere, the shorter the cell life, thus the shorter life expectancy. And so when you have free radicals and you have the superoxide free radical, what you do is you stabilize the telomere so that it doesn't fall, it doesn't continuously get short. So you're reducing the likelihood of early death, you're reducing the likelihood of disease and aging. The other thing that's in it, now see, Wendy, you shouldn't have asked me this question off the top because I can just roll with this one. I mean, that was a good question they asked me. I don't know about your listeners, but the other thing that you have in there, and this is a central point of my book, African American Healthy. I wrote that book. It is for anyone, but I targeted African Americans because in the research that I was doing that African Americans are dying at the rate of 2 to 5 times more than any other ethnic group while we're on medication for disease.
Wow.
This is not because we're not on medication. We're on medication. We're still dying more. But it was about the relationship between vitamin D3 and chronic disease. Now, again, remember, I'm talking about, I targeted African Americans, that this is for anyone. The studies show that 70% of all people in the United States are deficient in vitamin D3. For African Americans, 97% of African Americans are deficient in vitamin D3. But here's the relationship between vitamin D3 and disease. A deficiency in vitamin D3 is known to be a precursor to hypertension, to stroke, heart attack, diabetes, prostate cancer, ovarian cancer, uterine cancer, skin cancer, esophageal and stomach cancer, breast cancer. As a matter of fact, if I just focus on the cancers just for a moment, if the vitamin D3 level were to be measured and monitored, the range of normalcy for vitamin D3 in the blood is from 30 to 100. Now I'm going to just mention the units that it's measured in. Don't let that throw you. The units that it's measured in is nanograms per mil. That's like saying a dozen of eggs. You don't get confused about the dozen. This just happens to be nanograms per mil. So that's just how we measure it. When the vitamin D3 level in women and men gets above 50 nanograms per mil, the amount of breast cancer and prostate cancer drops 50%. This is anywhere in the world.
Wow.
When you get the vitamin D3 level up to 80 nanograms, remember the normal range is considered 30 to 100. If you get it above 80 nanograms, there is no evidence of breast cancer anywhere in the world.
Wow. Now,
you should have heard that on the news. There should have been headlines. You should have heard this, that, and the other. You won't hear it because vitamin D3 is so inexpensive.
Wow.
And what you do is you will undermine an entire industry of cancer therapy if they were to seize this information and use it. And the reason why I bring it up, guess what you got in Zeal?
Vitamin D3.
You have vitamin D3. Not only that, when I spoke to Mark and the rest of the team about adding vitamin D3, I said, listen, guys, if you can get the vitamin D3 level up in the product so that you can have at least 2,000 international units of vitamin D3 as a minimum. So in one bottle of Zeal, you have 1,000 international units. And one of your questions, Wendy, was, can you take more than one Zeal? The answer is absolutely yes.
Okay.
You know, you can take two. If you had to, you can go up to three. Now, you know, because the company recommends two, that's what I'll say. But from a medical perspective, yeah, if you needed to have three, you can go up to three with no problems.